Humanities Research Council and the University of Johannesburg have conducted a lockdown survey, providing insights into things like mental health as well as human rights. The survey focused especially on the first few weeks of lockdown after the declaration in March. To discuss this survey, we're now joined by Professor Kate Alexander from the University of Johannesburg on the line. Professor, thank you very much. Let's start with the rationale. I think this clarification is so important now because the new regulations for levels 4 and 3 have gone to court. So under a state of national disaster, rights may be limited if reasonable and justifiable in an open society. So is it fair enough to say you were testing if people don't mind some limits to those human rights for good reason, for health reasons?
Good evening. Well, we were testing for all sorts of different things. We were interested in the experiences of people under the lockdown and how their lives were impacted by concerns about coronavirus, and we were interested in their opinions. Certainly one aspect of this was the question of human rights. Another was the question of people's psychological health. We were also concerned with issues, for instance, of hunger and the way in which people were coping with the use of masks and things like that.
So let's start with generally, did they support the lockdown or feel their liberties were being infringed upon in any unnecessary fashion?
Yes, I should say that the survey was conducted up until the 11th of May, 13th of April to the 11th of May, and we did it in 3 phases between those dates. One of the things I found interesting about the question of the lockdown and people's support for the lockdown and whether they thought it was being implemented sufficiently strictly is that it was particularly poorer people living in informal settlements who felt that it needed to be enforced more rigorously. People living in the suburbs are much more relaxed about it. And that then correlates with the way in which, in the informal settlements, people had much more difficulty in making sure that they could physically separate themselves from other people. Whereas, of course, in the suburbs, it's much easier for people to stay in their homes and stay in their cars and so on when they go shopping. So there was general support for it. But when people were asked about the extension of a lockdown, there was a different response. And then you find that poorer people are less happy about continuing with the lockdown. And we think that that's because of their economic disadvantages. That if you're poor, you need to have a job. If you are poor, you need to be able to move around in order to secure an income so that you can feed yourself.
Yeah, so could that partly explain why the lockdown regulations have become more contested since the end of the first phase and we went to the lower levels?
Yes, I think so in part. You see, people are now concerned about the details of the lockdown. Some of it seems to be inconsistent, and we've seen the court pronouncing on that as well. But one of the big issues in terms of understanding differences between poorer people and those who are better off is the question of school education. So there's a big gulf there between poor people who are very, very concerned indeed that the lockdown might adversely affect the education of their children, and the attitudes of the better off people. Amongst the latter, they were less concerned. And I think that's partly, at least, because they felt that they could educate them at home, perhaps using online methods. Whereas poorer parents are worried about their children because they couldn't do that. They didn't have data, they didn't have electricity, and of course many of them wanted food in the schools. So I use this as just one example. What's clear for everybody is a concern for their safety, for their health, for not dying. And I think when we get to the schools issue, you can see that people want to have education for their children, but not at any costs. Yeah. They want to stay alive.
And I mean, staying with poor people, you included many quotes that I found interesting in this research. And it's sometimes said that many fear hunger more than COVID-19. Does your research back that up or dispute that claim when it comes to the fear?
Well, people fear both. And I don't think we need to distinguish between hunger and coronavirus. People are very concerned about both of them. Hunger is much worse amongst people who are poorer. But what's interesting is that when we asked about food parcels, we found that everybody across the board, didn't matter about the demographics, everybody felt that there should be free food parcels for anybody who needed them. So there is an element of social solidarity, of people concerned that nobody should die as a consequence of this coronavirus, whether it's death from the virus or whether it's death from hunger. People don't want to see the deaths.
How much support was there for tobacco and alcohol sales? Those were banned as well in the beginning.
Well, we were expecting that people wouldn't like those bans, but that turned out to be not the case. Generally speaking, people were quite content with the idea of banning the sale of cigarettes and banning the sale of alcohol. The figures changed over time, but the overall picture is very, very clear. Somewhat different between white people and black people. White people, particularly if they were older, were more concerned that they should have the right to buy cigarettes and alcohol. Poorer people were more willing to go along with the bans which the government had introduced.
Then, Professor, let's look at the psychology, and this is interesting. You talk about COVID-19 being described as the largest psychological experiment in the world. Just explain that.
Well, it affects the whole world, and it's very sudden, and it's very interesting, if you like, from a scientific point of view, to see the ways in which it is affecting people's psychological health. What we found is that the biggest issue affecting psychological distress, and we have a number of markers for psychological distress, was the question of hunger. So if you are hungry, you're much more likely to be distressed, and that affects people's anger, their stress levels, their fears, and so on, their anxiety. When it came to what we termed isolation, that is issues of boredom and so on, then it was different. When it came to isolation, it was particularly the students or learners who suffered as a consequence. So the factors leading to psychological concerns about isolation are different from the ones that affect psychological distress.
Yeah, very interesting. So 60% of those surveyed said they were stressed, only 29% said they were lonely. But we have to leave it there. Very interesting research, which government will be looking at as well. That was Professor Kate Alexander from the University of Johannesburg.